Imagine a world where you're afraid to go outside. A world where you haven't seen your relatives and friends face to face in years. A world where you feel like a prisoner in your own home. Parents and families with children under the age of 5 with medical issues and compromised immune systems, like Georgiana and her family, say that is the world they've been living in since the coronavirus pandemic began in March 2020.
She has no real contact with others her age. And to me, that, long-term effect on her development in these years is what keeps me up.
Georgiana is just 3 years old, so she's not currently eligible for any of the COVID-19 vaccines. Her family tried their best to protect her from the virus, but eventually they all got it. For Georgiana's vaccinated mom and dad, the virus wasn't much worse than a cold. But for Georgiana, it nearly killed her.
Just the difference between us being so well protected because we were vaccinated, her having the same exact virus and basically struggling to live.
Medical experts say there are some 18 million children in the United States under the age of 5 who haven't been vaccinated because the FDA has not approved of them. FDA officials say they're still waiting for the manufacturers to submit their vaccines for the youngest age group's approval. And even once they do, full approval for all children may not be given until June or later.
A lot of parents are getting very nervous and frustrated with what's been happening. While the rest of the world is starting to move on and mask mandates are being taken away, especially on transportation, things like planes, we still have a number of children, many of whom are too young to mask, who are not fully protected.
The benefits of the COVID vaccine are clear to pediatrician Dr. Alyssa Khan.
Because this is a vaccine that's literally been given billions of times. We know more about it than almost any other medication or vaccine that's ever been given. And we know that it's very, very, very safe.
Recently, a group of around 3,000 physicians and American Academy of Pediatrics members signed a letter asking for the FDA to speed up the review process.
What I would say to the people who are working on the vaccine is please work faster, because this is just as important. This is just as pressing of a concern for them as it was for us.